Greetings and welcome to the 2023 Asthma Award Winners webinar. Each year, EPA spotlights the best in comprehensive asthma care through the National Environmental Leadership Award in Asthma Management. This year's award winner, the Wisconsin Asthma Program, has an exceptional history of providing quality asthma care services throughout the state of Wisconsin. And at EPA, we are eager and excited to have them here today to share their program successes with all of you, especially during Asthma Awareness Month. Before we get started, I just want to go over a housekeeping item. So during our 1-hour presentation, we ask that if you do have questions, please submit them in the chat function on the right-hand side of your screen. Any questions submitted during our 1-hour presentation will be addressed from 3 to 3:30 p.m. Eastern Time on asthmacommunitynetwork.org. You do need to be a member to participate in the discussion forum. So there's some instructions here on the screen if you need to join asthmacommunitynetwork.org. If you're already a member, please join us at the discussion forum where you'll be able to interact with our speakers and we'll continue the learning. So I'll just leave this up for just a second here. Again, please feel free to use the chat function and submit your questions throughout the hour of our presentation. So we'll just get started by going over some of our learning objectives today. Our featured speakers from the Wisconsin Asthma Program will share their successful strategies for expanding the reach and effectiveness of their program. You'll learn how building partnerships strengthens community ties and improves comprehensive care, addressing all the social determinants of health, including indoor environmental determinants of health. You'll understand how to effectively deliver a home visiting program that delivers impressive reductions in emergency department visits and hospitalizations, and discover strategies for pursuing reimbursement specifically through Medicaid. So we're excited for this content. Now I'd like to introduce the featured speakers for today. Just introduce myself very quickly. I'm Tracy Mitchell. I'm a registered respiratory therapist and a certified asthma educator. I've been at the Indoor Environments Division at EPA for over 25 years, spearheading our efforts to improve public health, specifically for people with asthma. It's been a great honor and privilege to coordinate the Asthma Awards program for these many years and to collaborate with our winning programs, including this year's winner, the Wisconsin Asthma Program in the Wisconsin Department of Health Services. And now I'd like to just introduce our speakers that you'll hear from today. First, we have Christine Ramaker. Christine's responsible for managing the Wisconsin Asthma Program since 2006. She coordinates statewide programming to improve the quality and effectiveness of local and state level asthma control efforts. Christine ensures program strategies are in alignment with the Wisconsin Asthma Plan and CDC's Exhale strategies in an effort to provide high impact population and system-based initiatives, and provide a high level of collaboration with a wide variety of state and national partners to promote and implement evidence-based asthma control strategies designed to improve asthma care. We'll then hear from Megan Elderbrook. Megan has served as the epidemiologist for the asthma program within the Bureau of Environmental and Occupational Health since 2019. In this role, she conducts asthma surveillance activities and provides support to the Asthma Safe Homes program, which we're going to learn about today. And then finally, we'll hear from Carrie Tomasello. Carrie serves as the Environmental Epidemiology and Surveillance Section Manager within the Bureau of Environmental and Occupational Health, Division of Public Health. In this role, she oversees several environmental and occupational health surveillance programs and serves as principal investigator for the Wisconsin's asthma program. Dr. Tomasello also serves as an adjunct assistant professor within the University of Wisconsin-Madison School of Medicine and Public Health, Department of Population Health Sciences. So please join me in welcoming our speakers today. Now that we've met our speakers, I'd just like to take a moment to meet our audience. So if you'll all please participate in our polling question, please take a moment to answer what organization best describes what best organization you work for or describes who you work for. Our choices are government agency, healthcare provider, community-based asthma program, Healthy Homes program, or other. We'll give folks just another few seconds to choose one of our options. And let's go ahead and close the poll. Great, we have a nice selection, a nice variety of folks with us today. About a third of you are government agencies. We've got healthcare providers and Healthy Homes represented, and a nice selection of asthma community-based programs. So thank you all for joining us. I'm sure no matter what organization you represent, you will find some useful information here today. So with that, I just want to take a few moments to talk about EPA's role in asthma control. We all know asthma remains a significant public health challenge that's characterized by disparities. By bringing these disparities into focus, we see the impact that poorly controlled asthma has on the individual, particularly poor and minority children, and their immediate support network, as well as on the systems in place to provide and ensure care for these children. For example, Medicaid spends more than $10 billion annually to treat asthma in the United States. Social determinants of health, like substandard housing and community clinical linkages, play a role in asthma disparities. As technical experts on the built environment and health, EPA has contributed significantly to the evidence base grounding our collective understanding of the role of the environment and in-home interventions as part of comprehensive asthma care. EPA supports widespread delivery of in-home environmental asthma interventions because it reduces healthcare costs, increases savings, and expands the healthcare workforce. So in the next slide, what is some of the learning that has gone into our work, and how do we know what high quality asthma care looks like? Well, many years ago, we, in conjunction with the University of Michigan, conducted the Asthma Health Outcomes Project. And this conceptual framework that you see on the screen is based on those program results. That program and that activity identified the core elements of a successful asthma program and the processes that drive their implementation, continuous improvement, and endurance. So you see the 5 key drivers in the middle of the screen, and we're going to get back to those drivers in just a minute. Yep. Next slide. So over the years, as we've promoted this silo-breaking system for getting environmental asthma care to those who need it most, we've discovered that this is really a framework for the social determinants of health. We realize that communities who are focused on solving for the indoor environmental determinants of health. And so those are those modifiable environmental factors, things like household air pollution, mold and moisture, the presence of pests, chemicals, and other irritants, those things that influence risk and the experience of chronic disease. Indoor environmental determinants of health. Those programs who are working to address them are really working where housing, healthcare, and health disparities intersect. And this is an intersection where the social determinants of health overlap and pile up, especially for poor children and minority children. So in essence, the system for high quality asthma care is a social determinants of health solution. So on the next slide, as this work has grown and evolved over the years, we've surfaced asthma programs with successful healthcare reimbursement mechanisms in place for in-home education, environmental assessment, and low-level environmental interventions like cleaning supplies, mattress encasings, those types of things. We see healthcare payers are increasingly recognizing the role of the poor indoor environments as a determinant of health, and payment mechanisms are following, including for non-traditional members like community health workers. Leading innovators in the field are pursuing financing and partnerships that support structural services as a viable component of in-home interventions. And so in-home interventions that include structural services expand impacts and outcomes beyond the individual to the community level. So EPA's program supports community-level solutions for indoor environmental determinants of health using proven approaches and techniques. We support learning around the expansion of financing of and the access to in-home interventions, and we develop analytical tools to support stakeholder development of community-level data to target in-home interventional services as to improve asthma and health outcomes. So how does all this translate to our award? Well, we've incorporated all of this learning into our national recognition program, and the award application really incorporates EPA's system for delivering high-quality asthma care. So I invite you today, as you listen to the Wisconsin Asthma Team, listen for how they describe these key drivers in their program. Listen for their committed leaders and champions, their strong community ties, their integration of healthcare services, tailored environmental interventions, and all the high-performing collaborations. You'll also hear how their program was built, the results they're getting, and how they're using those results to sustain and grow their programs. So just another moment about the award on the next slide. This award is a unique contribution to the nation's national efforts. This is the highest recognition and the only national recognition that an asthma program can receive for delivering excellent environmental asthma management as a key component of comprehensive care. Our annual award surfaces successful programs and their approaches for addressing asthma at the community level consistent with our national guidelines and practices. The review of the applications brings EPA as well as our federal colleagues at CDC, HUD, and NIH together in consensus regarding the best approaches to asthma care. So on the next slide, you see this is an example of some of our previous winners, not all of them, but these programs represent the best in healthcare providers, health plans, and community programs who are delivering these comprehensive services. These programs, once winning the award, serve as mentors to other programs and serve as faculty to spread these best practices. So through asthmacommunitynetwork.org, you can request a mentor to help take your asthma program to the next level. I encourage you to access the program profiles on Asthma Community Network so you can go and see all of these different programs profiles and consider requesting a mentor that you think could help take your program to the next level. So today, as we welcome, on the next slide, we welcome Wisconsin Asthma Program as they join our Hall of Fame featuring over 50 winners across the country. And now I'll turn it over to Christine, who will talk about this award-winning program from Wisconsin.
Thank you so much, Tracy. We would like to thank you and EPA in recognizing Wisconsin for improving asthma care statewide, as well as our CDC asthma partners for their support that has allowed us to do this great work. I am Christine Ramaker, the Asthma Program Manager with Wisconsin Department of Health Services. Next slide. Today, I will be providing an overview of our program. Megan will showcase how we use surveillance data to inform decisions, and Carrie will describe how we work towards sustainable reimbursement for asthma services. Uniquely situated within the Bureau of Environmental and Occupational Health at the Wisconsin Department of Health Services, the Wisconsin Asthma Program has conducted asthma surveillance activities since 1992. In 2001, we expanded our activities under a cooperative agreement with the U.S. Centers for Disease Control and Prevention and created our first state asthma plan in 2003. To foster collaboration and build strong community partnerships, the Wisconsin Asthma Program spearheaded a collaboration in the early 1990s with the Children's Wisconsin Hospital System to create the Children's Health Alliance of Wisconsin. The Alliance became a natural partner for the Wisconsin Asthma Program as we convened and formalized the Wisconsin Asthma Coalition, also known as WAC, and developed our first state asthma plan. WAC is a diverse group comprised of more than 180 members spanning healthcare, education, state and local government, and tribal communities. Wisconsin's asthma program provides leadership in delivering comprehensive asthma care services that reflect the NAEPP 2020 focused updates to the asthma management guidelines and CDC's exhale strategies. We work with several partners who provide targeted, risk stratified, and tailored treatment plans to provide comprehensive asthma care. Innovative community approaches to reduce asthma burden include medication therapy management, empowering people with asthma and their caregivers to advocate for themselves, and in-home asthma education and environmental remediation. Medication therapy management, or MTM, is a distinct service provided by pharmacists to ensure the best therapeutic outcomes for patients. MTM includes 5 core elements: medication therapy review, personal medication records, medication-related action plans, intervention or referral, and documentation and follow-up. We have partnered with Hyatt Pharmacy to provide MTM and medication synchronization in underserved areas of Milwaukee. Hyatt Pharmacy's MTM program serves as a bridge between the patient and provider, assuring the patient is properly educated about their asthma and prescribed medications. We recently launched a new initiative with the Pharmacy Society of Wisconsin to provide enhanced pharmacy services to Medicaid-eligible asthma patients in 6 accredited pharmacies in Brown, Kenosha, Racine, and Milwaukee counties. In addition to asthma education, our pharmacy partnerships also provide referral into our Asthma Safe Homes program. Next slide. A patient voice focus group, an online survey, was conducted in the city of Milwaukee with a community-based organization whose focus is on assuring optimal and efficient outcomes for community members and service providers. Results will be used to identify barriers and challenges with provider communication and identify trusted information sources. Identified needs will be addressed as we create strategies for empowering people with asthma and their caregivers to advocate for themselves. Preliminary results have highlighted a desire for more health liaisons to educate patients, the need for more outside resources and programs, and interest in support groups. The Wisconsin Asthma Program has taken steps to support comprehensive community asthma care through our health system's Asthma Quality Improvement, or QI, initiatives. Together with the Wisconsin Collaborative for Healthcare Quality, our organizations are working with providers and experts from across the state to develop a measure of asthma quality that will be deployed across WCHQ membership. The measure will assess the proportion of patients with asthma who receive an annual asthma control test, which will allow healthcare systems to track and increase utilization of the ACT. Together with the American Lung Association, we are strengthening healthcare clinics' use of guidelines-based medical care through an ongoing asthma QI initiative focused on training healthcare providers to improve asthma identification, management, and outcomes among clinic patients. Over the past 6 years, ALA has provided training to providers in 40 Wisconsin clinics, including large health systems, federally qualified healthcare centers, and tribal clinics. They are expanding their clinic partnership to 15 additional sites in Wisconsin this year. The Wisconsin Asthma Program and the Alliance work with the National Environmental Education Foundation to bring NEAF's Environmental Management of Pediatric Asthma Guidelines training to Wisconsin providers. This training equips pediatric healthcare providers and other clinicians with knowledge and tools to manage environmental asthma triggers and provide intervention strategies. The Wisconsin Asthma Program has several initiatives that address indoor and outdoor environmental determinants of health. The Asthma Safe Homes program is our home visiting program that provides guidelines-based asthma self-management education, durables to reduce asthma triggers, and home assessment repair services to Medicaid-eligible children and pregnant adults with uncontrolled asthma. Asthma educators coordinate care with clients' healthcare providers to provide asthma control assessment results, update asthma self-management plans, and develop home trigger reduction recommendations. Clients may be referred to our pharmacy partners to receive MTM or enhanced pharmacy services. This program is the result of our earlier asthma care program pilot and successful collaboration with Medicaid to provide sustainable funding through a state plan amendment and new Children's Health Insurance Program Health Services Initiative. This program will be discussed in more detail in subsequent slides. In 2021, the Wisconsin Asthma Program, the Alliance, and the Wisconsin Climate and Health Program created the Breathe Smart initiative to build a network of school-based neighborhood air monitors in areas of Milwaukee with high asthma burden and air pollution exposures. Breathe Smart aims to empower people with access to real-time PM 2.5 data and education on actions people can take to minimize harm from unsafe levels of particle air pollution. In spring 2022, we pilot tested an anti-idling campaign at 2 Milwaukee public schools with high asthma burden near heavy traffic corridors. We counted cars and monitored air quality before, during, and after the campaign period, posted custom signage in English and Spanish, and created bilingual content on anti-idling that principals sent to parents, teachers, and students. Evaluation results and lessons learned will inform our efforts around student, family, and community engagement, curriculum integration, hands-on science opportunities, toolkit creation, and social marketing. Effective school asthma management programs can establish healthy and supportive learning environments, reduce absences, reduce disruptions in the classroom, provide appropriate emergency care, improve access and adherence to appropriate asthma medications, and allow for full participation in physical activities. The Wisconsin Asthma Program supports its partners in implementing the school-based asthma management program, also called SAMPRO, which includes 4 key components: a circle of support among families, clinicians, and school nurses, sharing asthma management plans with schools, asthma education plans for school personnel, and development of a comprehensive environmental asthma plan to assess and remediate asthma triggers. Milwaukee Public School District has prioritized SAMPRO with a goal of obtaining asthma action plans for all students in 110 schools. Wisconsin Asthma Program is assisting school districts in implementing new asthma programming to provide effective asthma management for students with asthma. School districts were offered mini-grant opportunities to participate in a variety of evidence-based activities, including staff education, the school walkthrough program, and ensuring all students with asthma have an asthma action plan on file. The Wisconsin Asthma Program continues to support the Alliance in implementing the WAC's school and child care walkthrough programs, which aim to decrease asthma symptoms by reducing exposure to environmental asthma triggers. Over 97 child care center walkthroughs and 201 school walkthroughs have been completed to date. The Alliance provides basic asthma education, conducts environmental assessments, and summarizes simple strategies to reduce or eliminate asthma triggers in a final report. A follow-up survey is conducted at 3 months and 1 year post-walkthrough to determine which trigger reduction strategies were implemented.
Hi everyone, this is Megan Elderbrook. I'm the epidemiologist for the Wisconsin Asthma Program. Today I'll be walking through Wisconsin's asthma surveillance data and go into how we use data from our asthma care program to help generate sustainable funding. First, I'll talk about asthma prevalence. This map shows the adult asthma prevalence for each state, using data from the 2021 Behavioral Risk Factors Surveillance System data, or BRFIS for short. For those who may need a reminder, Wisconsin is circled here in the upper Midwest. Wisconsin's overall asthma prevalence is 10.8%, which is higher than the US rate of 9.7%. Again, using 2021 BRFIS data, 15% of Wisconsin adults reported ever having asthma and 11% still have it. For kids, 10% reported ever having asthma and 6% currently have the disease. Next, let's look at some key disparities in asthma prevalence in Wisconsin. As you can see, there are large disparities in the Black and Indigenous populations, both of which have an asthma prevalence about 2 times higher than the white population. These disparities exist because of systemic racism that touches many parts of a person's life, including but not limited to access to high-quality healthcare, safe and affordable housing, good-paying jobs, and exposure to pollutants that trigger asthma. We also see large disparities among income levels. People in the smallest income group have asthma at 2.5 times the rate as those in the highest income group. Similar to racial disparities, people in lower income groups may not have access to high quality health care, safe and affordable housing, and are more exposed to pollutants that can trigger asthma. We see further disparities in asthma rates when considering race and income together. In this figure, the blue bars show people on Medicaid. The green bars represent everyone else not on Medicaid. Within each race group, people on Medicaid are about twice as likely to have asthma than those not on Medicaid. And then when you look at just the blue bars, you still see a disparity by race, as Black and Indigenous populations on Medicaid still have 1.5 times higher rates of asthma than white people on Medicaid. Next, let's talk about asthma control. These data come from the BRFIS Asthma Callback Survey, which is a second survey that's administered to people who answer yes to having current asthma on the core survey and agree to have a second phone call. The frequency of asthma symptoms, nighttime awakenings, activity limitations, and rescue medication use were used to classify asthma control into 3 categories: well-controlled, not well-controlled, and very poorly controlled. In this cohort, with data from 2016 through 2020, 39% of adults with asthma reported well-controlled asthma. And then 42% of adults with current asthma reported not well-controlled asthma. And 19% of adults with current asthma reported very poorly controlled asthma. Combining those top 2 categories, we can see that 61% of all adults with asthma reported that their disease was not well-controlled. We saw in an earlier slide that lower household income was associated with higher asthma prevalence. In this slide, we see that poor asthma control is also associated with a lower income. Among adults with current asthma, those in the highest income group were twice as likely to report well-controlled asthma than those in the lowest income groups. And here we see about 45% of people making under $50,000 reported their asthma was not well-controlled. And now adding on the very poorly controlled, we see that very poorly controlled asthma is greatest among the lowest income group at approximately 31%. If you look at the far right, you can see a very clear inverse relationship of control by income. As income increases, the prevalence of very poorly controlled asthma decreases. We also use asthma emergency department visits, or ED, and hospitalization rates for surveillance. The rates on the slide are per 10,000 people. In 2020, we saw a large dip in ED visits. This was not unique to asthma. Most conditions in Wisconsin saw a large decrease. I suspect that stay-at-home orders, the way health authorities communicated risk of COVID, and just the fact that hospitals were already overwhelmed with COVID patients most likely stopped people from seeking asthma care who normally would have. In 2021, the rates started to go up again, but not as high as pre-pandemic levels. We'll be receiving 2022 data soon, so it'll be interesting to see if the pandemic had a continuing impact on emergency care seeking behavior among people with asthma. This slide shows ED and hospitalization rates by age group. The age groups are on the left-hand side, hospitalization rates are in green, and ED rates are in blue. People in the younger age groups have higher rates of both ED visits and hospitalizations, with the highest rates among kids under 5 years of age. In this map, we can look at the geography of asthma in Wisconsin, specifically ED rates by county. The highest rates continue to be in southeast Wisconsin and in Menominee County, which is comprised of the Menominee Reservation. In recent years, we have seen higher ED rates in some central and northern counties as well. We use these surveillance data to target our interventions. All of the icons represent different interventions that we support through our CDC funding and Medicaid reimbursement. Most of the activities fall within high-burden counties, which are those shown in the darker blue. However, we also support some activities in lower burden counties as a result of asthma champions in those areas wanting to participate in some of our services. We always try to accommodate partners who want to improve asthma in their communities. The next data I'm going to show are asthma mortality rates. These rates are per 1 million people. Over the past 2 decades in Wisconsin, age-adjusted asthma mortality rates have been on a slow decline that kind of resemble a roller coaster. In 2000, the asthma mortality rate was 16 deaths per 1 million, or per 1 million people. And in 2021, it was 9.5 deaths per 1 million. One thing that hasn't really changed is the racial disparities among asthma deaths. In Wisconsin, Black people are 4 times more likely to die from asthma than white people. The 2021 rate for the Black population was 39.2 per million compared to 9.7 for the white population. Systemic racism likely plays a large role in this disparity. So next, let's shift gears and discuss some data we use to demonstrate the value of our asthma care program to our partners and to our Medicaid program. This pilot program included home visits for self-management education and an environmental home walkthrough. The asthma educators also provided recommendations and conducted follow-up visits 2 weeks and 3 months after the intervention. We collected self-reported data pre and post-intervention, and we're also able to use Medicaid claims to do a case control evaluation. First, we're going to look at some results from the case control study, which examined Medicaid claims for asthma-related services 1 year prior to the asthma care program versus 1 year post-intervention. The participants were compared to a control group of people with asthma with similar demographics who did not participate in our program. So we found this intervention had a 36% reduction in asthma-related ED visits, a 35% reduction in asthma-related hospitalizations, and a 37% reduction in the total days of inpatient stays. From our interventions pre and post survey data, we found that 79% of participants had improved their asthma control test or ACT scores from pre-intervention to 3 months post-intervention. And they reported 54% fewer missed days of school or work from 3 months pre to 3 months post-intervention. We also calculated the return on investment based on cost of administering the program compared to savings from reduced ED visits and hospitalizations for asthma clients. We found savings of $2.34 for every $1 spent. By demonstrating the need for increased funding for these services and highlighting our successes through these data, we were able to partner with Medicaid to provide sustainable funding and enhance our program. Carrie will now go into more detail on how this came about.
Good afternoon. I'm Carrie Tomasello, the principal investigator of our state asthma work. Our asthma care program was rebranded as the Wisconsin Asthma Safe Homes program in 2022 under new sustainable Medicaid funding. Let's look at some milestones that brought us to present time. We developed the asthma care program in 2014 to provide in-home asthma education under the CDC Cooperative Agreement, Comprehensive Asthma Control through evidence-based strategies and public healthcare collaboration. The goal of this grant was to maximize the reach, impact, efficiency, and sustainability of comprehensive asthma control services. Over the next 8 years, we piloted and refined our intervention. It was implemented in different areas of the state with high asthma burden using grantee organizations to implement. These included a health department in rural northwestern Wisconsin with a large tribal population, health departments in southern and southeastern Wisconsin, and a children's hospital in Milwaukee, the largest urban center in Wisconsin. We routinely evaluated our program and captured data to demonstrate improvements in health outcomes for program participants and the program's return on investment, as Megan just presented. Before continuing with the timeline, I wanted to share more about the Children's Health Insurance Program, or CHIP, Health Services Initiative, or HSI. Since the late 90s, states have had the option to develop a state-designed HSI to improve the health of children under 19 who are eligible for CHIP and/or Medicaid. The HSI is funded using a combination of CHIP and state funding. Both direct services and public health initiatives are permitted. Under the CHIP HSI option, a state may use up to 10% of its total CHIP spending for certain allowable activities, such as outreach and HSIs. States have flexibility to determine the focus, scope, and design of these initiatives. States seeking to implement HSIs must submit a state plan amendment, or SPA, describing the population served, how the HSI will improve children's health, and an updated CHIP program budget. The Centers for Medicare and Medicaid Services work closely with states to define and refine HSIs prior to the formal submission of state plan amendments. The first Wisconsin CHIP HSI was developed to fund work at the Wisconsin Poison Center and was approved in 2016. Following up on that success and on HSIs developed in other states to address lead poisoning, Wisconsin DHS began drafting an HSI in 2018 to fund lead hazard abatement in the homes of CHIP-eligible children and pregnant adults. This HSI was submitted and approved in the fall of 2019 as the Wisconsin Lead Safe Homes Program. During 2018 and 19, we in the asthma program researched other states' HSIs and found that Indiana, Maryland, Michigan, Missouri, and Ohio all had CHIP SPAs with lead health service initiatives. Maryland's lead HSI was unique in that it included an approach to address multiple environmental hazards associated with lead poisoning and uncontrolled asthma. We started thinking about whether an asthma HSI might be possible in Wisconsin and reached out to the Maryland team to learn more about their initiative. We also had conversations with the asthma teams in Missouri and Indiana to learn about how they reimbursed for in-home asthma education. During this time, we also met regularly with a Wisconsin Medicaid benefits policy analyst to better understand reimbursement strategies, such as state plan amendments versus waivers and other potential funding mechanisms, and with a Medicaid data coder to learn about billable services in Wisconsin at that time. In 2020, the Wisconsin Asthma Program, along with Children's Health Alliance of Wisconsin, applied for the Green and Healthy Homes Initiative's RFP for reimbursement support for asthma programs with comprehensive environmental health services. We proposed a project to convene asthma stakeholders in southeastern Wisconsin to define and create a sustainable funding model for home-based intensive self-management education and home environmental assessment services. The project involved a Milwaukee Health System as service provider and a Medicaid health plan associated with the hospital as payer. Through this year-long project, we received support on program evaluation, policy and economic analysis, and potential payment models. While this project didn't result in funding of services in 2020, it did increase our understanding of payment structures and allowed our program to develop a more compelling ROI for our program. In spring of 2021, the Wisconsin Lead Safe Homes Program started working on a SPA to revise their lead abatement HSI to include a primary prevention component. This provided an opportunity for us to draft a new separate asthma HSI to be included in the SPA. Using the asthma component of Maryland's HSI as a template, we drafted our asthma-specific HSI based on our prior asthma care intervention, expanding the services to not only include home visiting to provide education and home walkthrough, but also durables and environmental remediation. We plan to have two separate HSIs, one for lead and one for asthma, which was a slightly different model from Maryland's, although we did include a referral component between our lead and asthma initiatives. We met with leadership within the Wisconsin Division of Medicaid Services to get buy-in and to ensure available funding streams. Essentially, we would be using a portion of the CHIP dollars with state match that was also funding our Lead Safe Homes initiative. Our Wisconsin State Plan Amendment Coordinator met with us and reviewed our draft, shared it with other agency stakeholders, and incorporated it into the formal SPA submission in June of 2021. We received notification of approval from the Center for Medicaid and CHIP Services that our SPA was approved in September of 2021 to implement a CHIP HSI for asthma services. We began the hiring process for a program manager and a grant specialist to oversee program implementation, monitor project progress and reporting by funded organizations, and provide fiscal management. These positions were hired in February 2022, and with the rest of the asthma program team began preparing for program implementation. This work included developing program protocols, several RFAs that would be released to bring on organizations for training and to implement services. In addition, we identified and began working with a vendor to develop a web-accessible database for our organizations to use for the home visiting and environmental services data collection. We launched the Asthma Safe Homes program in August 2022 with the release of our RFAs to community organizations. And we learned in early 2023 that the two organizations involved in the 2020 GHHI Reimbursement Technical Assistance Project had just put in place an asthma home visiting intervention with direct contracting between the health plan and hospital system. This is our first example of a Medicaid HMO hospital payment model working together to implement in-home asthma education. The Asthma Safe Homes program builds on our prior CDC-funded Asthma Care pilot and adds the additional component focused on healthy living environments. The goal of the program is to address asthma and its housing-related environmental contributors among Medicaid-eligible children and pregnant adults. The HSI provides $2.5 million annually for program costs. These include asthma education home visits, durables to address home asthma triggers, comprehensive environmental assessment and remediation services, training to build a workforce of asthma case managers, educators, and healthy home assessors, and state program administration. The three components of the Asthma Safe Homes program are the referral process, asthma educational services, and environmental and remediation services. Our educational service providers will receive client referrals from their established partnerships. State program staff work with them to confirm clients' initial program eligibility based on their Medicaid enrollment status. For those clients not enrolled but eligible for Medicaid, the education providers will assist them with enrollment. Clients are then screened on a variety of asthma control measures, and those with uncontrolled asthma qualify for the program. If a client qualifies and agrees to participate in the program, asthma educators will conduct home visits to provide self-management education and a home walkthrough assessment. They will discuss low to no cost strategies to reduce asthma triggers in the home and provide durables to the client. In a subset of homes identified by the asthma educator, environmental service providers will conduct comprehensive assessments and home repairs. To participate in the Asthma Safe Homes program, clients must be children between the ages of 2 and 18 years or pregnant adults and Medicaid eligible, so either currently enrolled in Medicaid or eligible for Medicaid and in the process of enrolling. The client must be experiencing uncontrolled asthma, defined by having at least one asthma-related hospitalization, observation stay, or ED visit in the past year, a doctor diagnosis of moderate to severe persistent asthma, or referral from a school nurse for asthma symptoms, or an asthma control test score indicating uncontrolled asthma. And last, the client must be a Wisconsin resident. While our Health Services Initiative doesn't specify program service areas, we focus the initiative in year 1 in southeastern Wisconsin, including Kenosha and Milwaukee counties, experiencing some of the highest asthma burden in the state. The Asthma Safe Homes program provides a range of tailored asthma education and environmental services that follow the NAEPP asthma management guidelines. Asthma educators provide asthma self-management education during 2 to 6 home visits and at 2-week and 3-month follow-ups. The first 2 visits are required to be conducted in person in home. The client receives education focused on identifying and removing environmental asthma triggers, medication use, tracking asthma symptoms, developing an asthma action plan, and improving coordination with providers. Clients also receive a home walkthrough using a checklist based on the EPA and CDC developed checklist for home visitors to identify asthma triggers and provide tailored recommendations for trigger reduction. Clients also receive up to $1,000 of free durables, such as asthma-friendly cleaning kits, dust mite covers for pillows and mattresses, vacuums with HEPA filters, air purifiers, dehumidifiers, air conditioners, and other items. If significant asthma triggers are identified within the home, a client may receive a referral to Part B, the environmental services portion of the program for home repairs. Approximately 30% of homes participating in the Part A educational component will be referred on to Part B for environmental services. These clients will have a 3-hour comprehensive in-home environmental assessment completed by a trained asthma home assessor. After the assessment, a detailed report is developed which identifies hazards in each home, and a scope of work is created prioritizing those asthma-related hazards. Up to $5,000 per client's household is allocated to address those asthma triggers found in the home. Covered repairs in homes may vary and may include integrated pest management, repairing or replacing ventilation in the kitchen, bath, or whole house, removal and remediation of mold and water damage, moisture control measures to repair leaking or broken pipes, leaking windows, gutter, and roof repair, carpet removal and floor replacement, and weatherization improvements. Home repair and remediation services are available to participants who own or rent their homes, and service providers assist in obtaining the agreement from property owners for work done on rental properties. Our initial Asthma Safe Homes program, education, and environmental service providers are located in the target service area of southeastern Wisconsin communities. These include a variety of healthcare and community-based organizations, including a children's hospital, federally qualified health center, local health department, health education organization employing community health workers, and other community-based housing organizations. These organizations provide neighborhood-focused and culturally responsive services and work to address multiple social determinants of health to advance community-wide solutions. 6 grantees are providing in-home asthma education services, 5 in Milwaukee County and 1 in Kenosha County. 2 grantees are providing Part B environmental services, both of which are located in Milwaukee. Unfortunately, the program did not receive any applicants from Kenosha for providing environmental services during its first year. To increase the workforce and to prepare our grantees for success, we also contracted with the Green and Healthy Homes Initiative out of Baltimore, Maryland, to provide training and technical assistance to all of our grantees in year 1. We have some lessons learned to share. First, participate in all reimbursement technical assistance opportunities and learning opportunities that become available, such as webinars and trainings. You want to build your knowledge base. Second, showcase state-specific program results. When we had early conversations with Medicaid and presented national studies showing return on investment for these types of in-home asthma interventions, they thought that was great, but really wanted to see results from a Wisconsin pilot. Our Asthma Care program provided just that, state-specific results. We tried different methods of implementation in different settings and developed several new partnerships. Initially, the program flourished most within a healthcare system with direct patient referrals. When it was housed within local public health departments, it was more difficult to establish a streamlined referral. We collected program performance metrics and analyzed them annually. We developed summaries and calculated return on investment for our program. Over the years, we had several opportunities to provide an overview of our intervention or our pitch. It's important to have a short narrative or an elevator speech ready to go, as well as a one-pager summarizing your initiative and results. This leads to the next point. You never know when the opportunity within your state will present itself, so it's important to be prepared. Our last point relates to post-implementation of the Asthma Safe Homes program. We learned that if you're engaging with new partners who will implement the program, and it's a brand new program without healthcare referrals in place, it's crucial to provide some startup partnership development funds to the organization to establish the referral network, because without referrals, there won't be a program. In future years, we plan to expand the Asthma Safe Home program service areas to other geographic areas of the state with high asthma burden. We also plan to take insights learned from our work with GHHI and apply them to expanding the Asthma Safe Homes program in future years beyond its current Medicaid funding to include direct contracting with additional HMOs. We hope to present our asthma work during an upcoming Wisconsin Medicaid HMO Director meeting. We're excited about the potential for future partnerships with these organizations to add additional mechanisms to sustain our asthma education and environmental services. Here is our contact information if you'd like to reach out to us directly. Thank you for joining us today.
Amazing. Thank you so much to Carrie, Christine, and Megan. I heard so many nuggets there, and I loved your lessons learned. I think kind of in a nutshell, the important message is that successful asthma management really takes time. It takes partners, many partners at many levels. It takes data and your use of data to target your interventions and your other services is just amazing. It takes investment and again, it takes persistence, I think, to scale and sustain these programs. So thank you for sharing all of your work and your lessons learned over the many years. I'd like to congratulate you again, to say we are thrilled to be able to hold you up as an exceptional asthma program. Just for folks' knowledge, these photos were taken. We were excited to have Christine and Carrie here to represent the Wisconsin Asthma Program. They were here at the beginning of May in Washington, D.C. for Asthma and an Allergy Day on Capitol Hill. And this is where they were able to receive their recognition. So congratulations again. And thank you for your willingness to share in order to help others learn from your program. So before we close out, we do have a final polling question. We'd like to just get some input from our participants. Based on today's presentation, what action do you feel more equipped to take over the next coming months and year? So please participate and pick the option which best describes the action you're willing to take. Got you thinking about enlisting new community partners, about expanding your program services and in-home asthma visits. We heard lots of information about tracking and data and the ROI. So did that give you some ideas and some confidence for refining your tracking? Hopefully you'll consider requesting a mentor through Asthma Community Network if you are kind of having some issues with improving any component of your program. And hopefully you're looking forward to applying for next year's Leadership Award if you think, hey, our program looks a lot like the Wisconsin Asthma Program. Please consider applying for this recognition. We'll give it just another few seconds. And we can go ahead and close that poll. Wonderful. Many of you are interested in thinking about new approaches and enlisting new community partners. Really a nice representation across all of our suggested actions, and a few of you interested in applying for next year's award. So thank you so much for taking the time to give us some feedback. With that, I'll just remind folks how to access the discussion forum on asthmacommunitynetwork.org. We'll be moving over to the discussion forum. If you did post a question, that you will see that on the discussion forum, and you'll be able to interact with our presenters. And this is again where you'll find the answers to your questions archived. And in a week or so, you'll be able to access the archive of this webinar with the slides and the audio presentation. So with that, I thank you all for your participation today, and thank you again to the Wisconsin Asthma Program. We look forward to seeing you all in a few minutes on asthmacommunitynetwork.org. Have a great day.